problems when we're facing problems that last this long is that people tend to just get tired after a while. Easy like that, we're into the second day of this pandemic, and it's clear to see, at least to me, when I look around, when you see, well, you can't look around literally much now because there aren't many places to go and take that look around. But when you look online, when you see the results of the news that is happening on a day-to-day basis, you're seeing that it seems like a lot of people are getting tired now. People seem to be worried about the entire pandemic by now. And that is a problem, because when people get tired, they tend to forget some of the hard-learned lessons that we have already learned. And they tend to ignore things that would have been very important to them if they weren't already tired of the entire situation. There are some stories, there are some incidents that, had this have been the first month of the pandemic, a lot of people would have paid some of these things a lot more mind. But the fact is, we're into the second year now, and some people are just really tired. And that is a very dangerous thing, especially when you're seeing many politicians in our country, and not only our country, but we can speak for Trinidad and Tobago. Many politicians in Trinidad and Tobago seem to be using a lot of the incidents in this moment to just try and score political points. And the way how tired some people are of the entire thing, they are not going to take the time to pay attention to something to see exactly if the point you're making has any credence or value to it. So last week, the nonsense point made by a politician to help divide us some more was by none other than our own Prime Minister and the entire allegations about the vigil. And we see that news cycle came, it went, and the only thing that was left in its wake is more division and more annoyance and more frustration. And now we're seeing another bit of news cycle with this entire Couva Hospital business. Now, on the other hand, this may actually have some serious consequences at play in it, because this is a hospital. This is in fact the hospital that is in charge of some of the most sick patients in our parallel health system. And the arguments that go on over this could have repercussions on life. So the points being made about the hospital aren't by any means trivial or fickle. But during a time like this, some of these points, you could wonder, what is the point of the point? UNC goes to police commissioner over NCRHA Couva Hospital. The United National Congress said it will be filing a report with Police Commissioner Gary Griffith regarding the North Central Regional Health Authority's NCRHA management of the Couva Hospital and multi-training facility. The opposition announced that the opposition leader wrote a letter to the NCRHA on Tuesday, and she demanded certain answers. Two of the points that she sought to raise: that we will vigorously pursue all legal options are available for the NCRHA to produce to the nation their legal authority to manage and operate the Couva Hospital, that we will refer the matter to the Commissioner of Police for the immediate investigation into the operations of the NCRHA. All of this comes out from a specific incident where 4 senior doctors were transferred out from the Couva Hospital. They were said to be rotated out because they were trying to avoid burnout. At least that's what the regional health authority said. They were attempting to avoid burnout, so they transferred these doctors out. After the transfer, though, some of the opposition were alleging that this was a clear case of some kind of discrimination. For what reason exactly, I'm not sure. But it seems to me that there's something in this story that we as the public aren't privy of. We don't know some details within this story, and we aren't being told some of it. The actions that the opposition say they will be pursuing are because, well, for one, remember the opposition, when they were in government under the People's Partnership, they were the government in charge of building the structure of the Couva Hospital. So what they're alleging is that the Couva Hospital is meant to run on a relationship, on a deal basis with the University of the West Indies and the government of Trinidad and Tobago. So it was meant to be a sort of public-private partnership business. But they're saying that the health authority now is running this hospital. So if the hospital is for the most part private, then it would need to be registered, and then they're seeking to get some legal redress in that issue. And if it is not private, they're saying it's then in the location of the Couva Tabakit Talpara Regional Corporation. That's one of the regional corporations in our country where it takes care of more central and south. And they're saying if it is inside of this regional corporation, it's then supposed to be under the Southwest Regional Health Authority. This has some particular bacchanal in it, some particular friction, because the opposition is now in some loggerheads with the CEO of the NCRHA. They're saying that he made up some of the data where he said that since the doctors were transferred out, they have seen a 60% decrease in the amount of deaths in that hospital. If that is true, that is some very damning facts. But if it is not true, as the opposition seems to be suggesting and insinuating, then that's an indictment on the CEO. Because if he's willing to change around the data and lie through data to make himself look good, we do not want someone like that in charge of our health system. So that's an incident that really needs taking care of if there's really something to be done and a decision to be made in this area. But the problem is most people are tired. When you see most people's reaction to the headline here, from the time most people see the headline, the UNC is suing the health authority. How is that going to look? Bear in mind, most people don't read these articles. All people are going to see is the opposition suing the health authority. So we are in the middle of a pandemic. We need these doctors to help us, and it seems like our opposition now is going to sue these same doctors. While this isn't what is actually happening, that may just be the message that is being sent out. So some of this, while they may see an opening there where they may be able to make some mileage in political ground, there has to be some amount of tact in it. And to announce your lawsuit of the health authority while we are in the middle of a pandemic may not get you as much political mileage as you think. And I think it's just altogether unwise. And similar to Dr. Rowley's statement last week, our Prime Minister's statement, I think this method of going at this target isn't going to yield any results that would actually benefit us as a country. It may just prove to separate us more. I hope I am wrong, but I think I'm right. Because it's clear to me that people are becoming wary with these measures. And yes, it's true. They shouldn't be wary with these measures. They shouldn't get tired of it. We should be able to persevere and push through for the sake of our country and the future of our country. But we're dealing with humans, and how we want the world to be, how we think the world should be, isn't how the world actually is. And people do get tired of things, especially people in a country who have a culture where we are known for partying. We are known for our relaxed atmosphere. So are we surprised when 40 out of almost 50 people are held in a Beetham Gardens party? And this is just one of the many parties that are occurring. It seems like every other day there's another party that is being busted by the police, and it seems like they're fighting a losing battle. And even if the police comes in and breaks up these parties, and they hold someone and arrest someone, and they arrest 14 people. Now, the reason these parties are banned and we do not want these parties to be going on right now is because they stand the risk of spreading COVID. What do you think is going to happen when a police comes and has to manhandle 14 people and grab them and tackle them to the ground? No wonder so many police are getting the virus too, because they are in a position where they are fighting what seems to be a losing battle against a tiring population, and more it seems like these incidents are popping up. And okay, being tired may be an insufficient excuse for partying. Granted, it may be one of the excuses used, and you could find it as insufficient as you want to find it. If people are using it, it's an excuse being used and you have to find a counter for it. But okay, granted, I think it's an insufficient excuse too. But being party tired and going to a private test isn't the only kind of wariness we're seeing. Young Gopi School, some businesses breaking COVID-19 rules. Minister in the Office of the Prime Minister, Stuart Young, and Trade and Industry Minister Paula Gopi School said some businesses are flouting the public health and state of emergency regulations. The local Trinidad Minister of Everything went on to say, please try to work with us, work with the government. Work with everyone going forward. Do not try to find ways to get around the regulations. And Paula Gopi Schoon, who is the Minister of Trade, went on to specify how some businesses are attempting to find ways around the regulations by doing deliveries, by cooking on the low, and flouting several other of the regulations. And they're urging people not to do this, to work with the government as they are seeking to reopen the government through a phased reopening. I'm not sure any of those pleas fell on any listening ears, because regularly now I'm seeing more and more people advertising their own food and their own meals and their own cooks. And one of the problems is many people are finding themselves in financially difficult times. And when people find themselves in financially difficult times, as I've said in numerous videos, people get desperate. And desperate people tend to seek out their different options more openly and candidly, and they care less for whatever the regulations may be. Minister Young went on to say how some larger businesses were even advocating for the government implementing stricter measures. They were advocating to us today that any further restrictions that are needed to be put in place by the government, it was better to take a bitter medicine now and we have the results sooner rather than later. And the problem with that, I don't have a problem with bitter medicine, but the problem is, can you actually get the population to take this bitter medicine? If you bring the bitter medicine to the population, you bring the horse to the water, can you make the horse drink now? If what is already banned cannot be successfully banned, we have banned parties and there are still parties that cannot be stopped. They have banned the sale of food by restaurants, and now there seems to be 1 million small restaurants doing their own private and intimate deliveries, and some even cooking for you in your own home if you want to. So if you cannot correctly manage the current regulations that are there, how would you then manage the further regulations? That doesn't actually make sense. Unless what you're saying is you're going to give the police the authority to get very authoritative and quite police statish and enforce these with an iron fist, then there may be some positive results from that. But the positive results from that may be very short-lived, because there aren't even enough police to really man this country in an authoritative manner. But at least some good news seems to be on the horizon, with TNT being among several of the countries being promised vaccines by the United States of America. It seems strange. I saw someone on Facebook respond to this with "Help is here at last, finally," as the US promises to donate some vaccines. But China was here already. They already donated 100,000 vaccines, and there wasn't any help has been here at last. What is the difference? Why are some people so willing to take the help from the US and not the help from China? Or at least be as willing to give high praise for their donations too. The Chinese people helped us too. And while some believe there are strings attached, the ambassador promised us that there would be no strings attached, just as the US promised in this tranche that there would be no strings attached also. Are we to believe one more than the other? Prime Minister and CARICOM Chairman Dr. Keith Rowley held a telephone conference meeting with US Vice President Kamala Harris on Thursday. This meeting and these meetings on a whole were about the US and their promise of 80 million doses and the promise to give 75% of these through the COVAX facility. My wonder with this though is the COVAX facility has already proven to be substandard. Canada is already taking a lot of vaccines off the top of the COVAX facility. They have 5 times the amount of vaccines they need, and they still took from the COVAX facility. So if 75% of these 80 million vaccines are put into the COVAX facility, can we really be promised, can we really be assured that they would then be distributed equitably? And whose assurance would we take of that? Because the assurance was given since last year that that was the entire point of the COVAX facility. But we're seeing that point has yet to be clearly established. And honestly, by this point, I'm wondering, if people wish to donate vaccines, why go through the COVAX facility? Many countries are bypassing the COVAX facility now. And yes, there is a problem with bypassing the COVAX facility. It is said that by bypassing COVAX, if too many countries go past COVAX and do not go through COVAX, then it will nullify the entire facility and the entire program. But then, so what if the program isn't doing what it is intended to do? And we have received more vaccines in donation from China than through this COVAX facility, while we are supposed to be having these vaccines that we did pay the COVAX facility for. Bear in mind, we were not a freeloader in the COVAX. We paid into this thing, and we still haven't received what we were promised. So these vaccines being promised through COVAX isn't very promising to me, but let's see what will happen. The number of vaccines that TT has received so far is 67,200 from AstraZeneca from COVAX, 100,000 Sinopharm from China, 40,000 AstraZeneca from India, 16,000 AstraZeneca from St. Vincent and the Grenadines, 8,000 AstraZeneca from Bermuda, 10,000 AstraZeneca from Grenada, 2,000 AstraZeneca from Barbados. Our vaccine collection thus far is a who's who of donations. And nothing is wrong with having donations, but you could understand why some opposing politicians may have a point to critique the government with when you're seeing that it seems like all of our vaccines must be donated and we can't seem to source any vaccines of our own. That may be a problem, but there are reasons for that the Prime Minister has gone through over and over. You may have questions about whether you believe him or not, but I think that's the matter there. Talking about vaccinations though, just before I go, I see Antigua now is offering land for taking your vaccines. So first it was money, the $50 Eastern Caribbean, the 50 Eastern Caribbean dollars. Then it was a bucket of chicken, and now it's land. And they're saying it's not only for your first shot. The Prime Minister says the land offer also applies to those taking second COVID-19 vaccine dose. Now, listen, I don't know how far my channel reach is yet, but I'm speaking to you earnestly here. If you live in Antigua or you have a connection there, please make a request for them to open this opportunity up to their CARICOM neighbors. I am willing to be a member of the Caribbean vaccine tourism industry. I will come and you can give me the land and you can give me the KFC. We're missing it over here in Trinidad, and I will take that vaccine gladly. And I can assure you that some more of us Trinis will be very willing to come. So can someone put in a good word for me? And while you're putting in a good word there, share this video, drop a like, drop a comment, tell me what you think, and see you in the next video.
When you wake up in the morning and you hear the birds cry and you feel the music rising with the tide.